The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally. How many of you have heard of Chankapidra? The term literally means to break stone, which reflects its traditional use in treating kidney stones and gallstones. Modern clinical trials have suggested that it deals with these painful conditions extremely effectively by reducing calcium levels in the urine, promoting the flow of bile through the gallbladder, inhibiting the formation of calcium oxalate crystals that make up the kidney stones, and allowing them to pass more easily when they do occur. If you or someone you love suffers from gall or kidney stones, this formula from AOR is a natural alternative to ease their anguish. You can purchase Chankapidra at your local retailer or online at aor.ca or aor.us. Hello friends, welcome to Supplementing Health. For many of us, spring is a season of clearing out the old and making room for the new. So today I am joined by Amy Petrarca, registered nurse, licensed acupuncturist, and IFM certified practitioner to discuss the body's form of spring cleaning, more commonly referred to as detoxification. In her practice, Amy creates a structure that integrates her clinical experience from Western medicine with her holistic teachings from traditional and functional medicine to help her patients reach their optimal health. Hi, Amy. Thanks for joining me today.
Hey, Cassie. Thanks so much for having me as your guest.
So detoxification is a common topic, especially come springtime, when many of us have the urge to tidy up our lives, whether it be within our home, our office, or our bodies and diet. For those of us that want to focus on our bodies, what are the organs and tissues that we should really be looking at?
Well, Cassie, thanks. That's an excellent question. And yes, spring cleaning is governed by the element of wood, actually, and the liver is the custodian or general, shall we say, of the wood element. And the liver is one of the 5 organs of detoxification, whether you're looking at it through any of these lenses, honestly. But the other organs to focus on besides the liver are the kidneys, the lungs, the skin, and the large intestine.
And if we focus on the process of detoxification itself, what happens in your body during a detox?
Okay, so the word detoxification is, of course, a biomedical term because our bodies are always biotransforming and detoxifying, whether we're thinking about it or not. And then there is also the trendy language of, oh, I'm doing a detox. And so those are different things. And so I do think it's important for people to be aware of that. What's happening with the body detoxification process on a cellular level, the cells are getting rid of waste materials. And so that happens through membrane permeability. And in the body, in the liver, we need to transform fat-soluble substances into water-soluble substances to have them excreted properly from the body. And then, of course, even exhalation. We're exhaling carbon dioxide. And so cellularly, at the level of the alveolar sacs, there's a gas detoxifying.
And as you mentioned, like detox diets can be really trendy right now, but there's also some really extreme versions out there that aren't just about eating whole foods and supporting those organs, but really trying to flush the body, shall we say. And, you know, some people tote them as the next best thing. But can you talk to or speak to the concerns that exist around those extreme detox cleanses?
Yes, I'd love to. This is a common topic with patients. People oftentimes feel that doing a detox is something that's appealing to them after, the holidays, after, partying. For some people, they want to, do a detoxification after, medications, like chemotherapy, things like that. Some of the, fads, I guess I would say when somebody says like, oh, I'm doing a cleanse, I'm doing a detox, they may or may not be actually beneficial, and sometimes they can even be harmful. And this is what I really try to point out to patients. Our body is doing a great job of detoxification all the time, most of the time. Sometimes we do have troubles. If a patient has, maybe heavy metal toxicity or, a mold exposure or something like that, or even hormone changes can sometimes kind of, gunk up the detoxification pathways, if you will. However, I think the mistakes that people make when they're doing like a fad cleanse or a fad detox is they don't provide their bodies with the actual nutrients they need to push these enzymatic pathways in the body. And sometimes it causes such a stress that really what they're doing is liberating toxins that are stored in the fats, which, our bodies sometimes do store some toxins in the fat or the joints or the bone if we can't excrete them. And so sometimes people will actually mobilize toxins that have been stored, and then they have really bad headaches. They, say they feel worse when they're doing a cleanse or a detox. And it's really because they're not giving their bodies the nutrients they need to actually mobilize and literally flush out these toxins. Sorry for the long answer, Kathy, but, I do think that there are ways to do a proper detox thoughtfully.
And if people are to do a proper detox and make sure they're getting the nutrients to support those organs, could basically anyone benefit from a detox diet? Or is there certain groups that would be benefited, whereas others really wouldn't because your natural processes can manage it?
That's also a great question. Yeah, when someone says, hey, would I be a good candidate for a detox? Sometimes they have already, researched a particular cleanse or a plan that they want to do. There's so much information available now through, podcasts and books, and their patients are very educated, and they oftentimes know what they want. And so, one of the things that a person needs to do is make sure that they are eating clean foods, nutrient-dense foods that will support a cleanse or a detox. Also, hydration is key. People have to be properly hydrated. And then, things as simple but easily overlooked as stress reduction and getting a good night's sleep. These can also be really, really helpful in integrating a successful detox. And the other important variable is the length of time. And most people, they want to do a 3-day cleanse or even a 1-week cleanse. And those tend to actually be more, they can be more detrimental or more disruptive than doing a longer and slower. Start low and go slow is what we say. And so, some of the best detox programs are, 12 weeks.
Oh, wow.
Yeah. Even 4 weeks is better than a 3-day cleanse for sure. But yeah, back to your question of like who shouldn't detox. Of course, everybody, like I mentioned, always detoxifying and biotransforming chemicals and substances in their bodies. But folks that shouldn't do a cleanse or a detox are someone who has a known body burden of toxins or toxicants. If you find out that you have heavy levels of arsenic, cadmium, lead, mercury. These people absolutely need to reach out to a trained professional to help them thoughtfully do detoxification, sometimes involving chelation therapy. Other people that, would not be a good candidate are folks who aren't pooping. I tell people, if you're not pooping, do not do a cleanse or a detox, because the colon is one of the organs to move things out. And if you're constipated and you're one of these people that only poops once a week, a cleanse or a detox is not a good idea.
You had mentioned chelation therapy, and it's obviously a modality used to help with detoxification in very specific cases when you've had toxic element exposure or have like you said, a heavy burden of toxins within the body. But outside of that, what are some of the natural modalities available to help support your detoxification organs that people can consider beyond just lifestyle changes?
I think about healthy solutions as lifestyle changes. However, of course, as an acupuncturist and herbalist, I integrate these modalities with my patients to assist with detoxification and or just the health. Acupuncture and herbs can support the natural and healthy flow of qi. The body is very well able to maintain its processes and equilibriums, and then sometimes it does need a little boost. I like to sometimes think about acupuncture and herbs as training wheels. They give your body a little bit of a nudge to get back on track and support the natural system. So with acupuncture, there are specific channels and specific acupuncture points that can be utilized to support the body's natural ability to detoxify and cleanse. And with botanical medicine or herbs, there are so many plants that we think about, and foods, spices that we think about to support. So one of my favorite examples is ginger, how we use pickled ginger with sushi. And, in the materia medica, ginger is an herb that is able to reduce toxicity, especially of seafood poisoning. And, that's actually, as far as I know, the origin of serving pickled ginger with sushi is because it reduces toxicity.
That's interesting. I never knew that. I always thought it was for like a palate cleanser or something.
Yeah, it's also delicious, right? It's really delicious. But yeah, there's so many. Really, I think many herbalists think about herbs and foods and spices all in the same family. So, for example, curcumin is a really potent medicine that curcuminoids from turmeric root, and there's so many benefits from that. But if you ask someone, is turmeric a spice or a food or an herb? I would really hope for an answer of all of the above.
Yeah, it can be tricky to classify things, especially when certain components within a plant can be used, like you said, in multiple different ways. It starts to kind of muddy those lines. But I wanted to step back just for a second because you were mentioning acupuncture and herbs and all of these different modalities that actually fit within traditional Chinese medicine and traditional Eastern medicine practices. So I was wondering if you could speak a little bit about the philosophy behind those practices.
Yes, of course. I'd be happy to. Most people don't know that going to acupuncture school, to study traditional Chinese medicine, is actually the longest master's program in the country, in the United States. It's a 4-year commitment. And so it's, you really get to learn a lot about the history of Chinese medicine and philosophy. So I certainly couldn't hold a candle to my Chinese medicine philosophy teacher, but I'll do my best. So this is a 5,000-year-old medicine, and the origins of acupuncture and the origins of herbology are something that every practitioner studies. And what is important is understanding the lens of Chinese medicine. And so what's different about Chinese medicine compared to, for instance, conventional medicine? We're really, a similarity would be that we're looking at observation. So in Chinese medicine, we look at the earth, we look at the seasons, we pay attention to what's happening with the trees and the ocean and the wind. And we talk about these external evils is how it's translated. But then we also look at the person and what is their constitution, right? And so there's several different lenses of not just looking at pathogenic factors, and external variables, but also it's really important to look at what kind of person gets a certain illness. I think that's really important, especially, if we get into a conversation about the pandemic. But back to Chinese philosophy, what we're looking at is a balance of elements, a balance of seasons, a balance of yin yang. So there's yin yang theory is a very important theory in Chinese medicine. And also we have 5-element theory. I mentioned briefly that springtime belongs to wood element, but we have wood element, water, fire, metal, and earth. And all of these are just a way to explain relationships to systems and organs in the body. I explain to people the reason that Chinese medicine practitioners talk about, liver fire, kidney deficiency and things like that. This is just a language that we use to talk about pathologies before there were CAT scans. They didn't have CAT scans 5,000 years ago. So we needed a different language to understand the relationships between these organs. And then, of course, there's the vital substances. This is an important part of Chinese philosophy, understanding that we have essence, qi, blood, and body fluids. Usually we study it as what's called jing. And so there's the body managing these vital substances. And then the other thing that I think is just really important when talking about the philosophy of Chinese medicine, Chinese medicine is one of the only medicines that never did what I call the spiritectomy. They never removed the spirit from the person. And so actually focusing on, in Chinese medicine, we call it the shen, but focusing on these, the emotion or the spiritual wellness of that person is an important concept to integrate in traditional Chinese medicine.
Now, you had mentioned some of the herbs that can be used within traditional Chinese medicine, but is there kind of a list that if you're going to be supporting your detox organs, you should be considering to include in your diet and in your foods or cook with?
Yes, herbs can be a very thoughtful way to support one's body during a detoxification process. And, most people are familiar with milk thistle, let's say. Silymarin is known to support specifically the functions of the liver with detoxification. I also really like to use frankincense, or boswellia is another really wonderful herb to support the body. Of course, one of the things that's I think important to mention, whether you're doing Chinese medicine or functional medicine, the same herbs are not going to be right for every single person. So boswellia might be too warming for one person, whereas for another person, it's really perfect. And not only is the right herb important to use, but also the right dosage. And so I like to think about herbal medicine. It's like a recipe. Chinese herbalists don't typically prescribe single herbs. You know, there are some circumstances that that's appropriate, but we tend to actually put together a decoction or a recipe of herbs that are in a specific balance from the classical text to be in harmony, because actually herbs, when they are used together, they have a synergy and they can potentiate each other's benefits. And they can even reduce the toxicity of other herbs in the formula. And I think that's one of the beautiful things about being a Chinese herbalist is being able to know which herbs that you can add. I mentioned earlier, you know, ginger, but we also sometimes use licorice. We use a fruit called dazao. And then there are even sometimes fungal or mushrooms that can be used to decrease toxicity.
Okay, interesting. Yeah. It makes sense that you'd have to use multiple different herbs together. It's kind of like foods and flavors, right? You don't usually just eat one food alone. You try to mix it with other flavors and other textures to get a decadent meal, right? So it would make sense that you do a similar sort of process with your herbs. You're also a functional medicine practitioner, which kind of nicely goes hand in hand with traditional Chinese medicine because it's also looking at that root cause and getting to the bottom of the ailment and the symptoms rather than, you know, masking them or just kind of treating the symptom itself. Um, so how do you integrate your Western experience into your practice and marry that traditional Chinese medicine experience and knowledge with your functional medicine training?
Okay, Cassie, that is like, you know, hitting the bullseye in dark. I mean, that is a great question. It's like one of my favorite questions. I think there are not a whole lot of us functional medicine practitioners that have my background. Of course, there are a lot of nurses that are functional medicine practitioners, but I think as an acupuncturist, maybe less than 1%, I think, of functional medicine certified practitioners are in fact acupuncturists. So yes, I've done a couple decades in critical care as a charge nurse in emergency departments, tertiary care teaching facilities, you know, all over the country, which is wonderful. My first you know, since I wear many hats, I would say my first hat was being a patient advocate. I mean, that's what I feel that a nurse is, and a fierce patient advocate at that. You know, to work in an emergency department, you have to be able to reprioritize quickly, watch for signs and symptoms, use your skill set, and really speak out for what that patient might need, because you don't have a diagnosis to work with right away. And so, you know, I am fortunate enough that I've been working with patients in a Western setting for so long that when I'm looking at my patient's lab work or I'm looking at their MRI report or what have you, I have a lot of experience with being able to integrate those findings and even see what I call the missing labs. What labs are missing? Because in conventional medicine, you know, they're really focused on, you know, being able to manage an acute process and treat a disease. Whereas in functional medicine and in Chinese medicine, there's I think a bit of a greater focus on prevention and function. And so sometimes we really expand that palette of diagnostics to be able to get a wider lens to really capture some of these you know, sometimes more subtle indicators of imbalance in the body.
Awesome. Now you've touched on acupuncture a few times throughout our conversation, and I'd love to dive a little bit deeper into that modality of treatment just to better understand kind of the ins and outs of it. So I was curious, you'd mentioned there's specific acupuncture points within the body that help it to um, be proficient in its detoxification process. Can you share what some of those points are and why they're important?
Yes, I'd love to. Yeah, I love, as much as I love functional medicine and being a detective, I really love being an acupuncturist as well. It's a beautiful medicine. So in Chinese medicine and in acupuncture specifically, there, I touched briefly on these concepts of yin and yang, and also the five elements and meridian theory. And so in Chinese medicine, three of the key organs in detoxification belong to metal elements. And I think this is really important. Those organs are the lungs, the colon, and the skin. And if you think about it, these are three really important organs to be able to access and support a proper detoxification. And so why grasshopper, we would say, why grasshopper does metal have this responsibility? Metal is sharp and cuts things away. We can think about metal as a surgeon's knife that is skillfully able to remove a malignancy from the body. So metal has this skillful clarity, and we can think about cutting out poisons or toxins, let's say. And so in acupuncture, oftentimes we will use the metal channels for detoxification support. One of my favorite points on a metal channel is lung 8. And lung 8 is a metal point on the metal channel. So it's what we call a Harari point. And so it's like a double metal point. And this happens to be a ditch point. Some of the points in Chinese medicine have a translation as being a ditch point or a gutter point. And so it's like you imagine cleaning out the gutters. It's literally able to remove toxicity from this channel. So I've been using lung 8 a lot, especially in the pandemic, to help support the lungs specifically and the lung channel clearing toxicity. Another important point that I like to include with supporting detoxification, and I mentioned before about including the spirit, the person's mind. If their mind or their spirit is in harmony, then things are moving more fluidly. And so there's a wonderful point on the body called Jubin, and it translates typically as guest house or ghost house. And Westerners refer to this point as kidney 9. And so what is this guest house and ghost house about? Well, the guest or the ghost is the spirit. And so this point is about clearing the body of toxicity or negative energies so that the spirit has a safe and clean place to reside. And so I will credit one of my mentors and teachers, Mary Elizabeth Wakefield, with this one. She calls kidney 9 Botox detox because she always uses it on her patients after they get Botox. And it can also be used for patients after chemotherapy. But it's incredibly useful for purging negative energy. So if you've ever got into a conversation with, a fight with your boss or an argument with your best friend and or even a stranger, and you just feel kind of like you want to purge that energy, kidney 9 is an excellent choice.
Very cool. So does acupressure have the same effects as acupuncture, and do you use the same points in both treatments?
That's also a good question. Acupressure and acupuncture are two ways to stimulate the chi, along, at certain points or on certain channels. And, I mean, acupressure is a tool that's more accessible and portable, right? I mean, not everybody carries acupuncture needles with them, especially if you're not an acupuncturist. But just anyone could learn acupressure. You don't have to have a license to do acupressure. And so I think that it's more an easier, accessible tool. And so absolutely you can stimulate chi with acupressure and acupuncture. I think that if you want the way that I was talking about the herbs, how it's really a recipe, right? Like you're not really choosing just one herb. You want to really put together this thoughtful blend of herbs. The same thing, as an acupuncturist, you want to put together a thoughtful point prescription as well. It's like a symphony. And so, maybe I'm going to choose lung 8, which happens to be on the arm, and it's a metal point, and it's a yin channel. And if I'm choosing kidney 9, that's on the leg, and it's a yin channel. So if I really want this point prescription to be in balance, I'm going to choose some other points. I'm going to choose some points that are yang. I'm going to choose some points that are, different elements based on what my treatment modality is. And so unlike acupressure, with acupuncture, you can actually stimulate several points at the same time, and it creates a synergy and a harmony inside the body so that those points actually can communicate together. It's more, I think about it like a symphony.
Okay, so it's more holistic in that sense that you kind of get the whole picture all at once rather than individual pieces.
Well, it's just, I think that, they're just really different tools. And so, for example, if I have a patient who's really suffering with headaches, and, I can teach her how to use acupressure on Hagu, large intestine 4, on the hand. And she can easily do that for herself and possibly relieve her pain. And like I said, it's very portable. It's a very portable tool. So that might be a better tool for her. Whereas if you, wanted to help somebody with, for example, detoxification, I think that going to see an acupuncturist and getting a thoughtful, integrated point prescription treatment would be superior to acupressure in that case.
Okay, yeah, that makes sense for sure. I can see where each piece would make the best difference, right, or be more impactful. So for acupuncture, are there different sizes of needles that are used in treatment depending on location or depending on maybe what the ailment is that you're trying to address?
Yeah, that's a great question as well. And many patients, especially those that are acupuncture naive, would like to know some information about these needles. I have this wish that acupuncture needles were actually called acupuncture implements, because so many people are needle phobic, and they're, they associate needles with hypodermic needles, and those the gauge, when you're talking about a needle gauge, that's a size, but it has to do with the circumference. And so hypodermic needles are the same gauges as acupuncture needles. However, with hypodermic needles, we're using gauges like a 21 gauge, a 23 gauge, maybe a 25 gauge to give, an injection to, a child or something like that. And so people don't like those needles because they hurt. But with acupuncture, we have gauges 40, 38, 36. So the higher the number, the smaller the gauge, the smaller the circumference. So it's a much thinner needle, and they're about the sizes or the width really of human hair. In fact, they're pretty wimpy. It's almost like a little wet noodle. It's the first time I saw an acupuncture needle, I said, "Oh yeah, do your best. You're not going to hurt me with that thing. That thing is tiny." So the first answer to the question is the gauge is different and is much thinner. Then you want to look at the length of the needle, right? And so acupuncture needles vary from a few millimeters in length to, I think some acupuncture needles are, in excess of 3 inches long. Some are probably, 5 inches long. So you're choosing the gauge and you're choosing the length based on the point that you're going to needle and that person's body. Okay, so everyone in the state of California had to sit for the California Acupuncture licensing exam and be able to answer questions about needling depth and technique for every point. And so, for example, Zhongfu Lung 1 is needled obliquely lateral, I think it's 0.7 to 1.2 chuan, which is a measurement we use in Chinese medicine called a body inch. And so really the insertion and the depth and the angle, the technique that you use is different for each and every acupuncture point on the body. And licensed acupuncturists have to memorize all of those details to be able to pass a state board exam and practice acupuncture in the state of California.
I remember the first time I had acupuncture, that sensation, like you're fully ready for a needle prick in the sense of when you get an IV or, vaccination, and it's nothing like that. It's definitely more of, I would almost describe it as like a tingly sensation, like for a
Yeah,
lack of a better description. It's almost calming, right? It's kind of like a nice tingle on your skin.
it is. I'm so glad that you have had that experience, Cassie, and I'm also glad that you're sharing it because there's so many people that, like I said, they really have a negative association.
Awesome. Well, thank you so much for sharing all this information. I really appreciate it, and I think it's a great topic to explore.
Well, great. Yeah, I think so too. And it really is a beautiful lens to be able to integrate what's happening through the body with functional medicine and with traditional Chinese medicine.
If any of our listeners wanted to work with you or get a hold of you, how could they go about doing that?
Well, Cassie, thanks so much for asking that question as well. I am currently operating in San Francisco, California. I have patients, you can reach out and give me a call in the U.S. It's area code 415-846-0963. Or you can head to my website, which is actually going to be revised very soon. So I do apologize to anybody who lands on my antiquated website. It was pretty cutting edge in 2013, but that address is www.biohealth.com, and that's B as in boy, I as in indigo, A for apple, O for Oscar, and then the word health, HEALTH.com. And you can actually click onto my online scheduler and get a complimentary 15-minute consultation with me. It's been an honor and a privilege to spend this time with you today.
Honestly, it's been our pleasure. Thank you so much for taking the time to join me today.
Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic or email us at marketing@